Before we go through exactly where we are on the numbers, let's take a little bit of a step back if we can. It's important to keep our perspective in this situation. It's been so intense, and it's now been so intense for so long. What we do should be guided by what we've learned through this journey over the past 7 months. COVID has been a step ahead of everything we have done from day one. Literally, we didn't even know that it was here when it arrived. And as a nation, we were just wrong. The White House was pointing to China. It's the China virus, China virus, China virus. It was coming to California. It was coming to the state of Washington. But that's not where it came from. It came from the exact opposite direction. We're looking to the west. It came from the east. It had migrated from China, had gone to Europe, and the virus was coming from Europe, and we had no idea. They talk about, well, we did the China travel ban January 29th. Yeah, that's great, except it didn't come from China. It came from Europe, and there was no European travel ban until March 16th. Which means January, February, March, the virus was coming and we never knew it. And that's why when we had that first case, it just exploded because it had been coming for months. Well, nobody knew anything about these viruses. That's not true either. We had gone through this before. 2002 was SARS. Then the swine flu, then MERS, then Ebola, then Zika, and now COVID. COVID is a zoonotic virus, a zoonotic coronavirus, like MERS and like SARS. From China, like MERS and like SARS. From a wet poultry market in China, like MERS and like SARS. So we don't have the benefit of saying, who could have expected this? And then the mistake was compounded. The federal government abdicated responsibility. This is a federal crisis. I was in the federal government. When you say it's a 50-state crisis, you know what you're saying? It's a national crisis. When you have 50 states, by definition, that's national. And that's when the federal government steps in, and the federal government takes an active role in the leadership. Here, the White House literally said, it's up to the governors. It's up to the states. Well, if it's a 50-state problem, how is it not a federal problem? And when did states become in charge of handling global health pandemics, right? And when you made the 50 states handle it on their own and frankly compete against each other, we couldn't even get enough masks and gowns going through this. We couldn't do enough testing. Literally, we couldn't get enough Q-tips to do the nasal swabs. Learn those lessons. And the worst mistake is still ongoing. And that was the denial of the problem in the first place. You will never solve a problem you're unwilling to admit. And this White House from day one has denied the problem and continues to deny the problem. The second mistake is dividing the nation. It's a virus. You only stop the spread if everybody agrees to work together to stop the spread. That's the only way you stop it. The division, by definition, aids and abets the virus. That's what division does. Look at the great irony. They talk about community spread. It's in the community. It's spreading in the community. What is the only way to stop community spread? Forge community. Literally, community of the common. That spirit where I'm going to work to help you and you're going to work to help me. The division aids and abets the virus. And it comes down to the mask. How this became a political symbol in this nation, I have no idea. And how you can have every scientific expert say, wear a mask. New York State was the first state in the nation to mandate mask wearing. Every scientific expert, Projections saying 50, 60,000 people more will die because they don't wear a mask. And it has become a political symbol. Since when did basic humanity and saving lives become a political issue? Even after over 30 people get infected at the Rose Garden, you still want to say this is a political symbol? Now we're in the fall. The fall is a new phase. Well, what does it have to do with the seasons? It actually does have something to do with the seasons. And the scientists talked about this months ago, although the White House denied it. When you get to the fall, schools are reopening. Kids are coming back to college. It's colder outside. People are going indoors. You can't do the indoor dining as much. The fall itself has an effect on the spread of the virus. Again, there was denial, and now you're seeing the numbers go up all across the country. Literally all across the country, which causes a problem for us on a parochial level because people from all across the country come here. And we have states on a quarantine list, and we have people in the airports and questionnaires, but it is an imperfect system. The state protecting its boundaries. So the numbers are going up all across the country. You can't play catch up with a virus. You know who said that? A.J. Parkinson said that. New York, one of the lessons we learned, look ahead and stay ahead, right? It's not checkers, we're playing chess with this virus. Look ahead and stay ahead. The fall, you're going to see an increased viral transmission rate. Fact. And it's happening. Look ahead to the winter, which is going to be the season of the vaccine. Hopefully. Science finds one. But then you're going to have another really difficult, complex government issue. How do you administer the vaccine? But start thinking about it now. For the fall, we are going to deploy what we call a micro-cluster strategy. Well, there is no such thing as micro-cluster. You're right. There was no such thing as hotspot either. There was no such thing as a super spreader either, right? These are all post-COVID terminology. There should be a post-COVID dictionary for words that have come up only post-COVID. Microcluster would be in the dictionary, along with the other words. Up until now, what have we been doing? We have been targeting all our actions